witnessed the deadly surge of infections back here in March and April, or even if they had them. But health experts say it's better to think of the current burst of cases as a resurgence. Joining us now is Dr. Purvi Parikh, clinical assistant professor of pediatric infectious diseases and immunology at NYU Langone. Thanks so much for being with us this evening, Doctor.
Thank you.
So here's what I'm trying to understand. I think a lot of us were thinking of the term second wave because we thought that this virus, or we're thinking that this virus would mutate, and then that would be the second coming of it in a different form. So is that the case, or is it a resurgence as in it's getting stronger? What is the distinction?
Right. So, I think this is a resurgence, and we're very much, unfortunately, part of the very first wave. And I think the reason being is that, many states rushed to reopen before they were seeing a downward slant of the curve. So in order for there to really be a second wave, you would really need cases to go down to zero and then them to climb again. What happened in many places, they just waited for a flattening of the curve, which still means that there's a continuous amount, but they're not quite at zero. New York did a better job. We waited to see those criteria of 14 days of decreased hospitalizations, decreased deaths, decreased cases, made sure there was enough vacancy in hospitals before even phase one was attempted. So that's why we were calling it a resurgence, because the first wave wasn't really squashed.
But it's still basically the same virus, the same form of the virus? Yes. Okay. Okay.
Right. Same virus.
Okay. So let me ask you something else. There is evidence that shows simple tools like actually wearing a mask and social distancing greatly reduce the spread of coronavirus. But there's actually another study that says improving ventilation systems might significantly lower the amount of time that respiratory droplets carrying the infection are able to stay airborne. So how does one at home improve their ventilation? And then what about when you're in an office where you can't even control it, or at the supermarket?
Right. So ventilation is extremely important, just as important as the mask wearing and social distancing, because we do have evidence that these droplets can be airborne and stay airborne even for a few hours. So you can imagine if you're in an enclosed space with those droplets hanging around, it has the potential to infect everybody in that space. So, at home and in offices, simple ways to improve ventilation is just opening the window or opening a door, making sure there's continuous airflow and it's not a completely enclosed unit. Now, that might be more challenging when we move into the winter months.
Sure.
And, certain measures may have to be taken within the building itself to improve that ventilation. So hospitals have special rooms set up for this exact reason when there's infectious patients. And those type of units might have to be placed in large office building settings. But at home, it's fairly easy. You just open the window or the door.
Yes, well, I guess that's one of the reasons why working at home is a lot easier for a lot of people. Dr. Purvi Parikh, thank you so much for being with us. And Chief Meteorologist Nick Gregory.